As a CFO, how has your view concerning the best way to manage healthcare costs changed over time?
Well, Jack, first of all, I manage HR and finance, so I have to look at it from both the HR perspective and the cost and competitive facets. And what we found out is the cost increases have been significant, and through cost analysis, we've been able to mitigate those over the last several years.
Can you share some details behind your organization and how it currently manages and controls healthcare costs?
Jack, we have people based in China and in 2 factory locations in the States, and we have to deal with the cross-state differences with underwriters and plan offerings. It's been difficult, but we found by changing brokers who were and advisors who were able to drive the changes we need, get the information, we've been able to bring the plans closely together, treat our populations as one population for underwriting purposes, and keep the cost increases down to low single digits in the last 3 years. It's been all about cost analysis and finding the right partners who want to work with us. We're a 159-person organization with about 450 lives, so it's not a huge population, but we've been able to find people who want to work with us. We've also had to go from a very generous plan where we used to pay almost 100% of the costs with a small deductible. In fact, we probably pioneered self-insurance over 20 years ago, and we now had to get to the point where employees pay a modest amount based on their compensation, and we have deductibles at both the individual and family cap level to control the costs. We now do actions that in the past we wouldn't have done, including spousal and student verifications up to age 26, so we know we're not being abused. And we've gone into multi-year renewals where possible. We couldn't do it with medical, but we could do it with our short-term disability, dental, and prescription, where we actually got some multi-year rate caps or flat rates.
So how do you expect your approach to change? How will it change in the coming years?
We're using cost drivers. We've gotten information from our provider, and again, we're a small group, so we get information that allows us to understand what's driving our costs. So we've shared this, we analyzed it, and we've shared it with our employees, and our employees have responded. They're using emergency rooms much less. They're using mail order prescription services, and we'll take it from the awareness, and we're actually starting a wellness program next month. And we're taking our 3 high-cost elements, sort of the 80-20 rule, and communicating that to employees, and we're putting wellness programs in dealing with a fairly high diabetes rate and a need for exercise and some healthy nutrition. So we're going to drive that on a campaign where every month we have a new topic with our employees. We have healthy breakfast scheduled. We have guest speakers. We have some giveaways scheduled. And we hope that's results in better health and better awareness, and ultimately cost increases that are a little more reasonable. The other element we have under consideration is looking at a self-insurance or captive approach, but frankly we're scared of that because of the size of our company.